chances are you know someone who has experienced a stroke, and that's why it's so important to know the risk factors, but also how to prevent it. Joining me now is clinical nurse leader of the emergency department here at GBMC, Christine Foice. How are you?
I'm well, thank you. Good morning.
I'm happy to have you here, happy to be here actually at GBMC. Let's just start out with the basics for our viewers. Tell us what exactly a stroke is and how it can affect the body.
So there's two types of strokes. There's hemorrhagic, and that's one where the blood vessel bursts in the brain. And then there's the ischemic stroke, where the blood flow is blocked from getting to the brain.
And how does it affect the body?
Well, it can affect everyone differently. One of the things that we try to teach our patients is an acronym called BFAST, and that is B for balance. You can experience feeling off balance. E is for eyes. They can have blurred vision. F is for face. Oftentimes they'll have a facial droop. A is for arms. So arms or legs, you can have lessened sensation in either of the arms or the legs, or a lessened grip. S is for speech, and you can have slurred speech. The lastly is T for time, and time is brain. One of the most important things to know is that you don't have to have all of those symptoms simultaneously. You can have one symptom and be experiencing a stroke.
And so if you are experiencing these symptoms, maybe just one of them, you could be experiencing that stroke. And then once that stroke happens, then what happens to the body?
Well, if it's identified within a reasonable amount of time, 4.5 hours, if you can get to the emergency department within 4.5 hours, we can administer life-saving interventions.
And you mentioned that we should act fast, because if we don't, there could be some lasting effects from a stroke, correct?
Correct. Those would be difficulty walking. So if they experience weakness in the arms or the legs, then oftentimes they won't gain that back.
What about speech?
Again, it depends on the patient, and it's oftentimes they're aphasic. They may never find their speech again.
So really, time is of the essence. So if people get here quickly, it's only going to help them in the long run.
Correct. Within 4.5 hours is the best for us and them.
So even before we get to the point of actually having a stroke, we want to avoid it. So tell us some of the risk factors.
High blood pressure, high cholesterol, smoking, alcohol consumption, lack of exercise, and your diet.
Yeah, diabetes as well, correct?
Yes.
And correct me if I'm wrong, but stroke can affect men and women differently. Is that true?
That is correct.
Tell me more about that.
So women go through different phases of life: menopause, childbirth, sometimes birth control, and all of these things make women at higher risk because it's a greater risk of developing a blood clot.
Got it. And so because women, we have more chances of developing blood clots for one reason or another throughout our lifetime, we're more susceptible to stroke?
We're more likely to have a stroke than a man, yes.
Wow. And then how does it affect our body differently than men, or is it sort of the same?
We can experience different symptoms. Sometimes it's just generalized fatigue. Sometimes it's shortness of breath, headache.
And some people are surprised to find out that they can limit their chances of getting a stroke just by making some changes to their lifestyle. Tell me what those changes are.
Well, first would be exercise.
Okay.
If you can introduce 30 minutes of exercise daily, just taking a walk is great. Our diet, and one of the things we teach is the DASH diet. It's the dietary approach to stop hypertension.
Okay.
Limit your alcohol consumption. A woman should only consume 1 alcoholic beverage per day. Men can do 2.
And I'm sure cutting smoking as well.
Absolutely.
All right. So where can we go for more information?
You can go to gbmc.org/stroke.
Perfect. All right. Christine Foice, thank you so much for being with us. And we'll be right back with more Midday Maryland right after this. Stay tuned.